Hi everyone! Remember that this episode is part of our mini-series on diabetes. If you want to recall our previous discussions on diabetes diagnosis and treatment, just click the links in the screen, on the top or on the bottom. Alright, so once we have diagnosed and treat diabetes, we should assess glycemic status periodically in our patients. This will allow modifying therapies and avoiding diabetes complications. Remember, glycemic control is fundamental for diabetes management. So, how do we assess glycemic control? A1c assessment provides information about the patient's glycemic status over the past 3 months. And in general, this is the primary test for assessing glycemic control. Just as therapy strategies, glycemic goals should be based on individual patients' characteristics and social factors. For example, for an otherwise healthy young adult, we might set a lower A1c target goal than for an older adult with multiple comorbidities. For most of the non-pregnant adults, an A1c goal of less than 7% is appropriate. Lower levels might be beneficial depending on the patient's preference and risk of hypoglycemia. As I just mentioned, patients with comorbidities, limited life expectancy, high risk of hypoglycemia, or other adverse effects, an A1c goal of less than 8% is appropriate. Other assessment tests might include preprandial plasma glucose or peak postprandial plasma glucose levels, but A1c is the primary predictor of complications. Hence, it is the primary tool for assessment of glycemic targets. For our patient, Ms. Avery, a glycemic goal of less than 7% will be recommended. Assessment should be done every 3 to 6 months depending on the patient response and therapy changes. I hope you have learned how to identify, treat, and assess diabetes during this mini-series. Comment below if you have any question and share this video with your friends. See you next time!